WAPT News begins with breaking news.
Hello, everyone. I'm Erin Pickens. Governor Tate Reeves is giving an update on Mississippi's response to coronavirus. He's appearing in person for the first time since self-isolating after a spring break trip with his family to Spain. Here's the governor.
Here today, it's good to see all of you. I've missed you mightily over the last 3 weeks, and I know y'all know that I'm telling the full truth with respect to that. It is good to be here and have the opportunity to speak to so many Mississippians regarding COVID-19 and the coronavirus and Mississippi's response to it. Before I do so, with the wind being pretty heavy today, I do want to point out that Mississippi is likely to get storms later today. There could be some severe wind and there could be some tornadic activity as well. And so as Mississippians are hunkered down because of this virus, please be weather aware. Pay attention to what's happening throughout the state. Obviously, these potential storms are going to lead to putting even more stress on our system. Our emergency management agency is prepared. We have very competent people, and we will respond to anything that occurs during today's weather. But I do want to make all Mississippians aware to please pay attention, particularly in certain regions of the state where we expect to see some very tough weather later today. Obviously, we are all fighting an enemy, coming together to fight it as one. Over the last several weeks, I have had near daily conference calls with President Trump, with Vice President Pence, with the coronavirus task force that has been set up in the White House, leading medical experts, both nationally as well as here in Mississippi. And we have taken decisive action. In fact, we've taken very aggressive and decisive action to help protect Mississippians from this virus. On February the 20th, as our state was in the midst of fighting historic flooding, we activated the incident command structure at the Department of Health to mobilize our healthcare experts. At that time, there were 14 reported cases in the United States of America. We immediately set up our state lab, working with Dr. Dobbs and his team, who I will tell you that I have the utmost confidence in and the utmost respect for because of the work that they have done over the last several weeks and months, and the work that I know that they're going to do in the coming days and weeks ahead of us. We worked with them to set up our state lab to receive specimens and to run tests 7 days a week. On March the 4th, I signed an executive order establishing our COVID-19 steering committee to prepare all government for the joint response. On March the 11th, Mississippi State Department of Health confirmed its first coronavirus case in the state of Mississippi. Now keep in mind that doesn't mean that it was the first case that was here, but it was the first case that was confirmed. On March the 12th, we activated our Emergency Operations Center to a level 1. Now just to put that in perspective, my appreciation is we have activated our state EOC many times over the last 20 years, but the only time that we have moved it to level 1 status other than for the coronavirus was actually during Hurricane Katrina. Mississippians remember that that was not only the worst natural disaster in the history of the country at the time, it was 5 times worse than any natural disaster from an economic and from a financial standpoint. Yet we activated at a level 1 on March the 12th. On March the 14th, I entered the first state of emergency for the state of Mississippi, and we closed all schools around the state. We did so for 1 week so as to see what direction this would lead us and what additional actions would need to be taken. On March the 16th, I took action to activate the National Guard. General Bowles is here today. I appreciate him being here, and I appreciate the men and women in uniform who have stepped up, as they have done in every crisis in the history of America, have stepped up to aid in humanitarian efforts in our state. In addition, on March the 16th, we had a message to send state employees home and only allow for essential employees to come to the office, encouraged others to work from home. We also began providing pay for state employees, particularly those that were hourly employees, and we worked with the legislative leadership for them to pass the House bill that ultimately became law to ensure that our local governments, our cities, our counties, and our school districts had the statutory ability and the statutory authority to pay their employees during these times as well. We also had conversations with the U.S. Department of Agriculture, including Secretary Sonny Perdue, regarding the school lunch program. And given the fact that we had decided to close our schools, we wanted to ensure that those young people that were dependent upon the school lunch program would continue to have those resources available. And I was alerted just yesterday that over 120 school districts are currently operating under that scenario, with almost 360 locations around the state of Mississippi feeding through the school lunch program. On March the 19th, I took additional action as it relates to our schools by closing them until April the 17th through executive order. I said at the time, and I'll continue to say it, that was one of the hardest decisions I've ever had to make. Since being elected to office almost 17 years ago, I've made a lot of hard decisions. That was one of the hardest because I understand the impact that has on Mississippi families. I understand how difficult it is from a child care perspective, particularly for those that are in essential services, our healthcare workers, our doctors, our nurses, our nurse practitioners, and others. But I did it because I believed it was in the best interest of Mississippi and the best interest of Mississippians. At the time that I chose to do that, that extension was one of the longest closing of schools in the entire country. It sent a message to Mississippi and to Mississippians the importance of taking necessary action during this unprecedented time. On March the 20th, we had requested and we received notice from the U.S. Small Business Administration that we would be approved for SBA loans for our small business owners. You all know that small businesses are the backbone of our economy in Mississippi. They are the backbone of our economy in America. And while these times are challenging, they're particularly challenging on individual workers that work at small businesses, and they're particularly challenges for those who have dedicated their life to starting a business, developing a business, growing a business, and contributing to our economy. And I am so pleased that the U.S. SBA has approved that, and we're going to continue to work with small business owners to make sure they get the help that they need. Then on March the 21st, I took action to take away barriers to unemployment benefits to those who find themselves unemployed. Historically in Mississippi, and I think long term, these are good policies, but for times such as these, we had to relax certain things regarding employment benefits. For instance, there is no longer a requirement that an individual wait 1 week to apply for unemployment benefits in Mississippi during this crisis and during this state of emergency. There is no longer a requirement that an individual be out looking for work to receive unemployment benefits during this crisis. These actions, we believe, are going to go a long way towards ensuring that individual Mississippians have money in their pocket and they can provide for their families. We have been working closely, in addition to that, with our members of Congress, our congressional delegation, regarding the bills that are before the House and the Senate. We've had 2 supplemental bills that have passed, and we appreciate those. We are working, hopefully, to see movement in the United States Senate on a bipartisan bill that will lead to significant additional resources, hopefully for states and others in these challenging times. Our state lab, and I'm going to call on Dr. Dobbs to speak as soon as I get done, but our state lab has run tests for 1,400 patients, and our private partners and private labs have run many more. We're currently operating a 24/7 hotline that has answered thousands of calls, and I commend those who are working those phone lines every single day. The Mississippi Emergency Management Agency has delivered more than 210,000 surgical masks across the state, and we have delivered more than 236,000 N95 masks. We have worked with federal officials, worked with President Trump and Vice President Pence and their team to encourage them and to receive PPEs from the national stockpile. We have utilized the PPEs that we have in store at our state stockpile, but understand that both of those, while massive, are not unlimited. And because of that, we have gone out, we have worked through the traditional supply chain, and we have secured significant additional masks that are going to that have either come in over the weekend or will be coming in the days and weeks ahead. But I do want to encourage all hospitals, to all emergency management officials. We're going to do everything in our power to utilize the open market and to utilize the current supply chain to provide more and more PPEs. But I encourage you to do the same. Please, if you are a hospital, utilize your current existing contracts to try to purchase more supplies. We are all in this together, and we have to all work to make this a reality. Every county EMA in Mississippi now has personal protective equipment from the state for our first responders. We have had daily meetings with our emergency management team, with health officials, with our local partners, as well as with our federal partners. We just secured, after requesting from HHS and CMS, a Medicaid waiver to use more funds to combat the outbreak and best care for Medicaid patients in Mississippi. I will tell you that many of the bills that have been currently passed in the Congress, at least the two supplementals, there is the potential for us to get an additional FMAP contribution from the feds, and we're working through that process as well. We have worked with the State Department of Revenue, Commissioner Herb Frierson, himself a former appropriations chairman in the House, with Speaker Gunn, with Governor Hosemann, in ensuring that we deferred the state tax deadline from April 15th back to May the 15th. We have increased unemployment protections. We have secured paid leave for many workers. We have mobilized testing sites across Mississippi, and we have done so by doing things like shutting down certain sectors of our state. Obviously, from government offices that are non-essential to our schools, and I understand that we also saw the Gaming Commission shut down casinos. Again, all of which were in compliance with the recommendations given to us by the CDC as well as with the Mississippi State Department of Health. During this time, we have worked to issue clear guidance. That guidance continues. You must stay home as much as you can. Do not go out if you can possibly avoid it. Do not hoard supplies. We have assured you, as we have been assured by the President and others, that the supply chain is working. The supply chain is delivering groceries every single day. Our amazing Mississippi truckers and our amazing American truck drivers are working to ensure that those shelves get restocked. That is something that we must continue. I have to tell you, please do not hoard. This is not a time for panic. This is a time for caution. Listen to the experts, because I will tell you that is exactly what I am doing. Every decision that I have made has been based upon advice from the experts. My commitment to you is to continue to listen to them to protect all Mississippians. Those experts also advise, do not gather in groups of 10 or more. Use good hygiene. Reserve our test for the most vulnerable amongst us. If you're an employer, whether you're a government employer or a private employer, Please allow workers to go home if they are non-essential and can work from home. When we talk about testing, it was made very clear on the call yesterday with the Vice President and the COVID-19 coronavirus response team that testing if you do not have symptoms, you do not need to be tested. If you do not have fever in excess of 100.4, you probably do not need to be tested. If you are amongst the more vulnerable populations, and let me just say, the more vulnerable populations are those over the age of 65 and those who have compromised immune systems. So if you are currently undergoing cancer treatment, for instance, please stay home. In addition to that, I will tell you that we have a detailed pandemic plan. We have world-renowned experts, and we have a well-stocked, though not infinite, supply of PPEs, etc. Later today, I do plan to sign an additional executive order that instructs Mississippians to avoid non-essential gatherings of 10 or more, that tells all restaurants and bars to suspend dine-in services, again following the lead of the State Department of Health, using drive-through, pickup, or delivery to get people food. It will direct Mississippians not to visit hospitals, nursing homes, or long-term care facilities, again working to protect the most vulnerable populations. It will direct businesses to allow every possible employee to work from home, and it will ultimately define essential businesses to give clear guidance to our partners at the local level should they decide to take additional action in their communities based upon the potential for local knowledge. I have committed to transparency through this process, and I will continue to offer transparency. Understand that we are not at the end of this pandemic. In fact, we may still be at the beginning stages of this fight. The virus is new. We do not know what the future holds, but we do know that this virus is not to be taken lightly. We have emphasized that from day one, and as the data comes in, we will understand that even more. In conversating yesterday with the call with other governors and our federal partners, there is hope that the 15 days to slow the spread of virus that the President instituted some 8 days ago and concludes on Monday of next week may be having the intended consequences. But we don't have enough data yet to know that for sure. As that data continues to come in and as the CDC and others continue to monitor that data, we will have more information to make better, more informed decisions. We also know that every action that we have taken to date does have unintended consequences. Every action echoes through our communities, affecting thousands of people's ability to earn a living. It affects thousands of families, and it affects thousands, if not hundreds of thousands of lives. These decisions have been amongst the hardest of my career. I am hopeful that we do not have to choose between the effects of this virus and the potential for abject poverty coming out of an economic disaster. Our health experts tell us that is not the case, and I trust them. I make you a solemn promise. I will take every action that our experts tell us will protect Mississippi's most vulnerable citizens. That is my job. I will make hard decisions, and I will do what's right for the people of Mississippi. Now, as I conclude, I want to thank all of you for heeding the call to take action, to stay home, to wash your hands, to practice social distancing, to not gather in groups of 10 or more, to protect yourselves and protect your neighbors. And in addition to that, I want to thank the literally hundreds of thousands of Mississippians who have offered their prayers for my family and for their fellow Mississippians. Your prayers mean more than you will ever know. All of us are in this together. Those of us up here, the staff in our hospitals, the truckers on the road, and the workers in our stores. Those of you in the media, thank you for the way in which you're covering this pandemic. Thank you for providing information to our constituents, to our fellow Mississippians. Thank you for the job that you're doing. We are all in this fight as one unit. In the 4th chapter of Ruth, verse 14, we read, "Who knows whether you have come to the kingdom for such a time as this?" I believe in God's providence, and I believe that He placed every nurse, every worker, every teacher, every reporter, every grocery bagger, every parent in our positions for such a time as this, because our state and our country need all of us to do our parts. Be smart, because we do not know when this will end, but have hope, because we do know we will make it through. Thank you, and I'm going to ask Dr. Dobbs to come give some remarks.
Good morning, and thank you, Governor Reeves. I would like to just share how incredibly supportive and thoughtful the governor has been, and our political leaders taking this so very seriously, making sure that we're thoughtful about every step along the way, trying to protect lives in Mississippi. Just an update for today, we are reporting 71 new cases, bringing Mississippi total up to 320. So we expect to see continued increases in cases over the next days and weeks, although we're doing everything we can to figure out how we can stop the spread of this virus. We're working very closely with other healthcare partners, trying to enhance the capabilities of testing. And if you go to our website and see in other publications that there are more and more options for getting assessed for COVID and also getting testing. And we're really excited also that the community health centers across the state have joined the fight, and every community health center is going to offer assessment and testing, especially for those who are uninsured or maybe need additional financial support. We're also working with health centers to make sure that we enhance capacity such that if we do see a surge of cases, if we do see a surge of hospitalizations, if we see excess need for intensive care units or ventilators, that we have an ability to rapidly increase that capability. This is something that we're working on very aggressively, because we do not want to have a situation in Mississippi where we have to make life and death decisions based on the supply of ventilators or ICU rooms. That's something that we take very, very seriously. I would like to implore everyone to please follow the social distancing guidelines. We're still seeing pockets of people clustering together in ways that would promote transmission. If you're piled up outside of a retail store trying to get supplies, that's not social distancing. Please do everything you can to stay out of congregated groups. We have reports of people still congregating in mass around weddings, around funerals, and going to church. I know our faith is very important to us, but part of this is for our neighbors, and if we really love our neighbors, we will make sure that we honor these best practices, because we have seen significant outbreaks of disease when people in faith communities have gathered together, and we've seen pretty remarkable outbreaks. So please, just for this period of time, honor these social distancing guidelines. That's all I have to say, and just thank you all for your support.